If you spend 5 minutes scrolling through wellness advice online, you will inevitably hear about cortisol. It gets blamed for everything from stubborn weight gain to brain fog, treated as a toxic chemical you need to urgently purge from your system. Yet, if this hormone were inherently destructive, it wouldn't be a requirement for survival. Every single morning, right before you open your eyes, your brain initiates a massive, deliberate surge of cortisol into your bloodstream. This daily release is orchestrated right here, under the direction of the brain's hypothalamus and the pituitary gland. The pituitary is a small, pea-sized organ at the base of the brain that controls the function of most other endocrine glands. The relentless internet focus on lowering your overall cortisol volume misses how the endocrine system actually works. The total amount you produce matters significantly less than the highly specific schedule your body follows to release it. It is a precisely timed wave that regulates your sleep-wake cycle, blood pressure, and inflammation. Without it, your body simply cannot respond to basic daily challenges or illnesses. This graph shows a healthy 24-hour cortisol rhythm. It begins low at night, rising sharply toward morning. This peak puts you in go mode, waking you up and mobilizing energy. Daily stressors force temporary jumps before it drops back to baseline. These brief spikes are entirely normal. Your body pushes the levels up during acute stress because it is activating a rapid response kit, adjusting your immune activity and energy stores to help you cope with immediate demands. A temporary surge after a poor night of sleep does not equal a dangerous hormone imbalance. Those momentary jumps are the exact mechanisms your body uses to adapt and survive. In the final third of this chart, the hormone must fall to its lowest point so your body can rest. Trouble begins if the line refuses to drop, flattening into a sustained high elevation overnight. The body loses its recovery window entirely. A demanding month at the office rarely causes this kind of structural breakdown. When the nighttime drop completely disappears, clinicians look for a specific physical driver. The most common cause of clinically significant cortisol excess is prolonged treatment with steroid medicines, specifically glucocorticoids like prednisolone. Glucocorticoids are a class of drugs that reduce inflammation and suppress the immune system. Far less commonly, the body itself manufactures too much of the hormone. This state of pathological excess is known as Cushing's syndrome, a rare endocrine disorder where the adrenal glands overproduce cortisol without stopping. A stressful day will make you feel tense or wired, but persistent cortisol excess creates a measurable, long-term strain because the body has lost the biological ability to turn the stress response off. When you are constantly stuck in go mode, the short-term benefits become liabilities. Your resting heart rate climbs, your digestion slows down, and deep sleep becomes impossible. Over months and years, this excess creates severe structural strain on the cardiovascular system. In established hypercortisolism, hypertension, or chronic high blood pressure is a major source of long-term illness. The physical changes become highly distinctive. Patients often develop insulin resistance, severe muscle weakness, loss of bone density, and visibly fragile skin that bruises easily. Because poor sleep and fatigue overlap with many other conditions, doctors rely on careful laboratory testing. Hormone levels cannot be interpreted accurately without looking at the patient's specific symptoms and medical history. To find out if a patient has a genuine pathology, clinicians frequently use late-night salivary cortisol testing as a first-line screening approach. Saliva offers a highly practical window into the body's internal clock. By collecting a sample late at night, when the hormone level should be at its absolute lowest, doctors can see exactly if the normal, healthy rhythm has flattened out. Your body relies on this constant rise and fall to navigate the world. Recognizing that rhythm and understanding why the wave matters far more than any single spike is the actual foundation of hormonal health.